During stops in Springfield and St. Louis, Governor Nixon discussed the impact of strengthening Medicaid on mental health and public safety. Right now, many mentally ill individuals don't have health insurance and go without the proper treatment.
Without the proper care, their condition deteriorates with the results you'd expect: homelessness, poverty, crime, and sadly suicide.
The threat to public safety increases as these Missourians become increasingly unstable. Right now, many of those in need of mental health treatment end up in emergency rooms or the criminal justice system, placing a strain on hospitals and law enforcement.
It is one of the #1 reasons why people seek care in the emergency department. And quite frankly, the emergency department is not the best place to take care of those mental health needs.
We did a survey last fall of the population in the jails in the city of St. Louis. Over 50% had psychiatric needs that we believe, and I believe as a law enforcement officer, can't adequately be addressed in a criminal institution like that. They need to be in health facilities, specifically mental health facilities. They can diagnose, can treat, can medicate.
It's not uncommon at all to be no beds, and patients are sitting in ERs all across the state, being boarded, waiting for a bed, while law enforcement stays by their side to try to, because they're not in care yet. So it's a very serious concern that will get worse if we don't expand Medicaid.
A new report released by the Department of Mental Health reveals that strengthening Medicaid means improved access to treatment for individuals with mental illness.
This ultimately means healthier communities, stronger communities, and equally importantly, let's not kid ourselves, safer communities.
The report also shows that if Missouri's Medicaid system is not strengthened, mental health care will not remain status quo.
If the expansion does not occur, we will go dramatically backwards.
We are currently in a very, very difficult situation. Without Medicaid expansion, it goes to extreme to almost desperate.
We have so many uninsured patients that it's a struggle to keep the doors open. We're currently about 40% of the patients that we treat in the city of St. Louis have no insurance and are in mental health crisis. So we have the same obligation to treat them. The lengths of stay for those patients are the same as any patients we have. So we provide that care, but with no reimbursement.
Governor Nixon's plan would bring $5.7 billion to Missouri and provide health coverage for an additional 300,000 Missourians, including an estimated 50,000 in need of mental health services. For more on the governor's proposal to strengthen Medicaid and to view the full DMH report, visit mo.gov. For Missouri Now, I'm Jacqueline Lapine.